Friday. Thank you very much for joining. Uh, uh, I think this is the first time you all are joining online. And today with us again we have three people from Wikipedia, uh, Dr. Amin, Dr. Laith, and Mariam. So I will not take much time. Over to you, Dr. Amin, for introductory remark, and then we will proceed for our today's session. Over to you.
Okay, well, good evening to you all. Good morning here from California. I was smiling with the teammates from Palestine that I'm away from my sleeping family, but I'm delighted to join you this in the course, continuing to support you as you do important work, if you will. This is the beginnings of your communications with patients and loved ones and people who read Wikipedia for health information. I was delighted to see that you're all making some active edits. It's really heartwarming to see, and I hope you can see from your course dashboard that people are reading your work. So when I look at the course dashboard, I see that you've already added, I'm just going to refresh my screen here to see, 10,100 words. You've added 78 references. The pages that you've edited is 31 of them, and there's 149,000 views so far, just since the time you started editing. So I think that's really something to be proud of. In any case, I'm going to turn it over to the Palestine team to talk a little bit about the remarks that we've prepared. And after that, I have some more thoughts to share about some updates, just to compare and contrast between your course and previous experiences I've had with other students. So Miriam, are you the one who's presenting tonight? But you're muted. You're muted, Miriam. Let's just see. Miriam is working, I think, on unmuting herself. That's my guess. Let's see. If I push this request sent to unmute you, let's see if that helps. Okay, I can see that you're working on it, so that's fine. Still can't. There you go. I'll try again.
Yes, I am able to hear now.
Yeah, I'm not seeing that I see two versions of Miriam, so my guess is that you're connected twice to the WebEx, and sort of we're just figuring out which of the two uses the audio that could connect you. So you can keep working on it and feel free to interrupt me anytime, and then so I'll tell you if I hear you as I speak. Does that work for you, Miriam? Thumbs up if that's true. Yeah, okay, got it. Perfect. Okay, well then in the meantime, what I'd like to do is just certainly if any of you have questions, please feel free to put them in the chat. With my courses and what we did with Palestine and what I do with my students here, we at this point in the course, we've moved towards a place where you all should feel comfortable contributing to Wikipedia. You've made your successful first few edits. And we move towards a place where I think about it like a Wikipedia editing works in progress. So each week or each time we meet, it's a chance for us to dialogue with each other as a community of health professionals about the contributions we've made, where we can debate whether we should be including the content we've written or not. So for example, with my students, we will talk about, if you are talking about common symptoms of a disease, should we include every symptom that's ever been known in human history of that disease for what we write on Wikipedia? Or should we just include some of the more common symptoms? If we list symptoms, should they be listed in alphabetical order, or should they be listed in the order of most frequent to least frequent? And if we list, for example, side effects of medications that are known, that are appropriate treatments for diseases, should we list every side effect or only the serious ones or only the health-threatening ones that one should seek additional assistance from clinicians from? So these kinds of questions can really only be answered by people like us as we debate, as you learn more about health diseases and symptoms and medications, how much to include on a general public purpose facing source like Wikipedia. So in my own student groups, we end up having very rich discussions about this because healthcare is obviously a partnership between us as clinicians and the patients we're privileged to serve. So I think that those kinds of discussions are a rich, meaty, or sort of healthy part of the work you do as students. And I know that this came up in Palestine for sure. When we dialogue about this, there's obviously the space we use here, the space you use as students privately, so whatever WhatsApp channels you guys want to use or whatever you use in your school or your course. And then there's the public-facing Wikipedia side. So what I wanted to do was just remind you the Wikipedians who contribute to Wikipedia or who you may interact with on the talk page. They're dedicated. Many of them are very passionate about this work. And we don't really know how much they have clinical expertise. Some of them are scientists, some of them are health professionals, and some of them are not. But we never really know when you dialogue with Wikipedians. And so it's always important to remember to treat them with respect. I think that sometimes they're more knowledgeable than I am about certain aspects of Wikipedia rules and guidelines, and sometimes they're more knowledgeable than me about the health content I'm writing for. So I always try to remember that working with them is similar to working with patients who may disagree with what I'm saying as a clinician. And I need to find a way to communicate respectfully, share why I believe what I believe, and understand their perspective and where they're coming from. So what I wanted to do is show you, again, I'm just stalling for you, Mariam, so as soon as you interrupt me, feel free. Maybe
Yeah,
she's talking.
can you hear me?
Yep, we can. Hooray.
Finally. Yes,
Yay.
so the other device, unfortunately, I won't be able to open my camera in this
Okay.
case.
Better that we
Yes.
hear you than see you. No problem. Ailesh, shukran. So I'll let you go ahead and speak. If you need me to share screen or anything, tell me and I'm happy to do so.
Yes, I'm still navigating. Okay, so
Okay. What I'll just tell you what I was planning on doing and you guide me, and if you need me to stall more. Nope, there's your screen. We can see you. So go ahead. When you're done,
yes,
I'll take the mic back. So
right. I actually have two screens, so I shared the wrong screen. Screen
I
two.
have the same problem once in a while.
Okay. Hello, everyone. My name is Mariam, and I'm one of the mentors for this course. And today you're going to be assigned to peer reviews. So I will be telling you more about how to do a peer review on Wikipedia. But the first step before delving into this subject, I wanted to go over the user talk function again. So when you open a Wikipedia page, here you can open your talk page. And in the talk section, you click on add a topic. And here you would write your peer review. The subject is a peer review. And then you will talk about what to write here. I'm editing the following page. And so here we have people working on, for example, aging. You would paste the link, and then you will talk about what exactly did you do on this page. So for example, I have improved the introduction section. I have added on the causes section and exactly what you did. Why did you do that, and why do you think that is important, so that when someone else's peer reviewer is going to do the peer reviewing, they exactly know what you did and why you did it, and then they will edit on that. And so you would add this topic, and so once you go to your teammates or the person that you will be peer reviewing, you will go to their user talk page, and then you will see the section, and you will exactly know what to do. So for example, I want to see some, let's see what do we have here? No, not find articles. So I want to see the articles that Nirmal 101 is editing, and I'll just copy their user, and here user talk, and then I'll just, and so here I can see if they have a heading for the, I will know what is the article that they were working on. And how do you edit? Did I publish it or not? Okay, so now that I see, let's see someone else is here and I want to edit on their page, or I want to peer review. So I also, no, sorry. I will click here, edit, and then I will write here, responding to Wikimedium. And then I will write my peer review here. Okay. So I wanted to ask if you know what featured articles are. Have you discussed this before? I'd like Dr. Amin.
I think I want the student voices. I know we don't see any cameras on, but you can all at least put it in the chat so Mariam knows that you're awake. Is anybody familiar with the concept of Wikipedia featured articles or good articles?
I'm not sure how to check the chats, to be honest.
I'll check it for you, Mariam. I see it on my, because I have WebEx on mine, so I'm seeing. So for example, one student told us they could hear you earlier. So let's just see if any of them can write something in there. Dr. Chinmay, I will smile with you that the same thing happens worldwide, where students are quiet on Zoom or WebEx or quiet and cameras off, and we try the same struggle worldwide to get them to engage.
That's fine. Okay, so when you go on Wikipedia, oops. There is a shortcut for featured articles. So Hrishi Kanadi, I hope I did not butcher your name. They said, okay, the message is now gone, but
Okay,
I don't know how
what
to
you
open
didn't
the
say,
chat.
Mariam, if you didn't see it, Hrishi, thank you, said articles rated by wiki editors, which are some of the best, are their answer for what the featured articles are.
Yes, that's a very good explanation. So how to open featured articles, there's actually a shortcut for that. So you would write WPFA and you'd get, so here is the list of, so this is the list of all the featured articles for, and each day they're updated. And featured articles, there's about 6,000 featured articles out of 6 million articles in the English Wikipedia. That's about 0.1% of all articles. And you want to strive to have your article to be featured on Wikipedia. And what are the criteria for this featured article? I'll go over them in very briefly. So there's 4 categories, and each one. So first of all, it should be well written. It means the writing is engaging, it's simple, and it adheres to professional standards. It's also comprehensive. The details, it does not exclude any important or major details that need to be said. And it's also very well researched. There's a lot of secondary resources, and there's a lot of citations, and also the citations make sure that if you're using a certain citation reference, so for example, Harvard or APA or MLA, you stick to one citation style. The article should also be neutral, so without any biases, and it also should be stable. What stable means is that there are no editing wars. There's no two people deleting each other's work and reverting it, and so it's relatively everyone has agreed that this work is like fairly good. And also, it's compliant with the Wikipedia's copyright policies. You can read that. You can read more about that by clicking on this link. And it also has a lead section, means like an introduction section where it summarizes the whole topic and it prepares the reader for the next details to be discussed in this article. It has the appropriate structure. So in your case, you're using, where is it? Okay. Let's go. Okay, and there's consistent citations. So also, if you're using any medias, the media should be relevant, and you shouldn't overuse media, like depending on the article. If the article requests to have images or audios, then use that, but don't overdo it. And also the length is very important. If it's too short, it's an indicator that you need to add more details. But if it's too long, check out what is making this article super long. Maybe there's a section that could become a different Wikipedia article. So, for example, if you're talking aside from medical, like if you're talking about Mumbai and you want to, there's a section about the history of Mumbai and it's a very, very long section, you can separate that, summarize it in a paragraph or two, and then make a different Wikipedia page that is dedicated to the history of Mumbai. And obviously, you strive to make your article of class A or of grade A. Okay. So, and then what makes a good article? It's that it adheres to all of these rules. And once you have edited your article, and once you have, you need to put it on peer review. So in your case, you're peer reviewing each other, and then once you think that your article is good and it's great to be featured, you would write. Okay. So you would go on the peer review Wikipedia, and you would upload. You would request someone from Wikipedia to review your article, and you would start getting. So in the discussion section here, you have people with. Okay. So you can find topics from arts section, from yes, and then someone will take on this article, they would review it, and then they would tell you whether it's suitable to be featured or not. And okay, so that's my quick introduction about peer reviewing. Would you like me to go over? Let's see some of your works. Did
Yes.
did we assign the students to
That's a good question. Chinmay, have we decided if you're going to assign peer review groups reciprocally or whether you're going to just let the course dashboard automatically assign, or how do you want to do peer review?
Automatic. We would like to automatically assign.
Okay, so the one thing that's likely going to happen is you're going to shuffle the teams when you do that, unfortunately, because I'm not sure if it'll automatically keep the teams concordant with each other. So you'll just need to make sure that if you go that route, that that students aren't. It depends on how you want to slice it, because each student would be
So,
assigned to conduct a peer review of a random student. And so, for example, student A on jaundice might peer review false awakening, but student B on jaundice would peer review cardiac cycle. So what that means is each of your pages is going to get 5 or 10 peer reviews, depending upon how many students are per team. That's totally fine. The point here is for the students to practice the skill of conducting a peer review. And so it's fine if there's multiple peer reviews per page. Sometimes professors want the students to conduct a group peer review, and that, for example, would be all 5 students who edited jaundice will together write one peer review for the cardiac cycle page, and then those 5 students for cardiac cycle might reciprocally peer review jaundice. So I think it's just a matter of you deciding how you want to structure it for your students.
so I think let me assign group, and we will have group to group review. So there will be no chaos in the reviewing also, that one will get one and one will get multiple. So
Yep.
I think by tomorrow I will assign the group to review other groups page. And just I would like to share the student that you can right now see that certain article has been assigned B, certain article has been assigned C. Mariam, can you just scroll the screen up little bit?
What is it you want her to show?
Just go down so that we can show the student that few of the article has been featured good also. You can see C, B, G,
Oh, yeah.
A.
Here it is.
So it is a good article. So like this, your article has been graded by the Wikipedia editors. So we will assign the reviewer to each other. And Mariam, I request you to again once slowly show the review process. If I want to, so is it compulsory for each editors to make a talk page started before other can review it, or without that page also other can review?
I can answer this for you, Miriam. So different courses do this differently in terms of where the peer review occurs, right? So we think about where we talk to each other on Wikipedia. You could you could have that dialogue on your talk page as a Wikipedia user, or their talk page, or on the page that you're editing, right? And so I find that you have to think, what's the conversation I'm intending to have? And so that helps you decide where to have that dialogue. For peer review, the same thing applies here. You could conduct the peer review on the talk page of the person doing the review, or the person receiving the review, or the peer review could be on the Wikipedia page itself. And so, so Miriam's doing me the favor of showing the talk page of jaundice. And if we scroll down on this talk page, we may find a peer review, because this was previously contributed to by other students in a class assignment. And so if we find one, we'll see if we see it. If not, Miriam, I'll take over sharing screen and show you. Actually, let me do that. I'll go ahead and share my screen. So I'll take over, allow. Oh, I've got to allow. Yep. Okay, let's see if that solves that problem. Okay. So I think you get to decide. Let's see if this works. Got it. Screen. Let's do screen 2. Okay. Hopefully you guys are seeing. Yep, there it is. Seeing my screen.
Yeah.
Yeah. So, so here's an example of one page that I'm just going to show you several points I'll make before we decide where your peer reviews get posted. Here's a page that my students worked on in a previous cycle of my course, uveitis. And if we look at the talk page, here is some dialogue between Wikipedians about this page. And so you can see here, there's a debate that this particular picture of uveitis scared some Wikipedians, right? You can see here, right? So they're saying, move the picture, move the picture, move the picture. But someone else says, as someone who had uveitis, do not take down that image. It's the most painful thing I ever had, so keep it. So you see here that this dialogue is appropriate to be had on this page rather than in the talking between these Wikipedians, right? Here, let's go to Open Fracture, another page that my students worked on in a previous cycle of my course. And if we look at the Talk tab, here we'll see a group of students from Queen's University that were working on improving the article as a class assignment, um, and a dialogue from a Wikipedian, just specifically that encouraging the students to do a lot of work, right? So here you can see a plan for those students, the medical students, group 13 in this class, to work on incorporating antibiotics. And so they have a sentence here that's on the talk page, or a section of the talk page, where they have 4 references that they're working on. So this is almost like a sandbox area, right? But then you see a Wikipedian that says you should review the medical style guidelines, and make sure that you don't put direct quotes from those pages, right? And so again, here's a dialogue with one of those students replying to that Wikipedian around changing that. Here's another student example where they were discussing what they were going to work on during their class assignment. Lots of sort of work. And then here's a peer review. So in this example, the peer review is living on the talk page of the page they're editing, on the Open Fracture talk page, rather than in the student private talk pages, or not private, but just the talk pages of the individual Wikipedians. So it's entirely up to you, Dr. Chinmay, how you do this. I personally, in my courses, like to see the peer review directly on the Wikipedia page itself, and it's for one very specific reason. If we do this, then the Wikipedians who like this page, who care about this page, can continue responding to the peer review and doing these recommendations long after your students finish their class. And so I like having the peer review publicly here because it's a chance to make Wikipedia even better. Other faculty prefer these peer reviews to be more private, or on those talk pages, or in your course sort of learning management system. It's entirely up to you how you'd like to do it for your students, because you know them better than we do.
So I mean, just I request you to, can you do this for one of the page created by student?
Absolutely. I mean, so if we go to your course and we look at the articles here, these are the pages that your teams have been editing, right? And so we're just picking at random non-steroidal anti-inflammatory drug. So if we look at the talk page here, we can see that there was a comment 4 months ago here about whoever was discussing this, whatever. So if you wanted to add some dialogue to the talk page, we're going to edit, all right? Oops, and I want to do visual editor. Oh, can't do that here. Let me go back here. I think visual editor doesn't work on the talk tab, if I remember correctly. So I'll just demonstrate that we would be creating a new talk thread. Let's do that. And topic. Here, review on this page. I believe, oops, students, I believe there are students who are working on this page as a class assignment. This is a new talk thread for peer review by those students. Okay. Okay, so here's an example where this peer review section is now here. So if one of the students wanted to reply to this, you could hit reply right in your peer review, right in the response to the peer review here, et cetera, et cetera. I'm not going to write that in now because I'm not peer reviewing right now. Is that what you wanted, Chinmay?
Yeah, so students will know how to review. Yeah. Can you again
Okay.
just once again just steps?
The steps of conducting peer review is what you're just asking about?
No, just what you did right now. That
Okay,
only.
right. Okay. Yeah, I think that the key here is to think about like where do you want things to live. So again, in my courses, I just make the students do the peer review on the actual pages that they're peer reviewing. But you can decide what's best as long as the students know where to find everything, right? So, Miriam, was there more you wanted to say before? I know I took over, but let me just see if there's more that you were planning on talking about.
Yes, it actually depends on how you do the assignment. So if it's a person to a person, then they can use their user talk pages. But if it's a group together, then preferably to do the peer review on the page itself, on the talk page that they're reviewing. So.
And then later, of course, you might end up responding to the peer review. And so I just wanted to show you that, an example of that. Yeah, here's a good example. So this is one of my courses, again, from 2022. My students were working on polycythemia, or a student. And so that student chose to write down their work plan, what they were going to do when in my course. So you can see that it was a weekly course, and each week the student had some plans for what they were planning on doing. And so you can see that they were expecting to receive a peer review, and then they were going to respond to the peer review in the last week of the course. Okay, so here is the dialogue between students. Here's the peer review from one of my students to that student, right? And so, and then the response for the peer review. And so what I love about this is it's public, available for everyone to see, so that any Wikipedian afterwards could decide how they wanted to improve the page after the course was done. So, and what I really, really think is valuable about doing peer review here is that you all move from being, what's the word to use? Passive recipients of the internet, of Wikipedia, to active contributors, to future physicians, right? Because this is the kind of thing we must do as clinicians, is to constantly be checking with each other to raise the professional bar of our careers, of our professions, so that we can always use the most high quality scientific expertise and in the serving the patients we serve. So this concept of peer review, this is what you will do the rest of your careers, even if you're not writing it on Wikipedia. Chinmay, there's other stuff to talk about with like plagiarism and or like just sort of dialoguing with Wikipedians, but I don't know if you have any other suggested topics or content you want to address regarding peer review before I move to that.
I think you can continue, please.
Go ahead. You said go move on.
Yeah.
Okay. Miriam, was there more you were going to say? Again, I was hoping you would finish your portion before I did mine.
It's just some tips when
Okay.
doing peer reviewing. When receiving the feedback, sometimes you may feel like a bit disappointed, or that someone is attacking you. Just always assume that everyone is doing this out of good faith. And yes, so that's like one of my advice, because it happens a lot when your comments get reverted. You get feedback that what you did is not suitable or something, but always take that as in good faith. Do not take it personal.
Love it. Agree. I couldn't agree with you more. We are a community of Wikipedians. You are a part of that community. You are doing good work, and when you receive that feedback, it's all in service of raising the quality for everyone together. Totally agreed. Okay, well, there's a couple more points I wanted to make. One is just this notion of plagiarism. And so I wanted to show you from my own sort of students' work. In my courses, sometimes, not frequently, but sometimes I'll get a notification like this, where the bots on Wikipedia detected a possibility of plagiarism by a student in one of my courses. And so this is the email I would receive. And then I just wanted to show you what it looks like when you click on the report. Let's see if it's coming to the other screen. So here's an example of a Wikipedia sort of or there's a tool called Authenticate, which is just looking at, it's crawling the web and crawling public and what's the word? Copywritten material. And it's comparing the content on Wikipedia that was created by students to that. And so in this example, old age and driving, sort of you can see the text that was written by a student, and the red sort of highlights is saying that there's this claimsjournal.com crawled the internet, found some journal text that closely matched the text that my student wrote. Right. And so here, rules for older drivers, the key right over here. So rules for older drivers in the United States. So this text on the left is what the student wrote. This text on the right is what's in the journal. And so it is suggesting that there's a 51% match there of that text. And as we look at that text, you all and I all can figure out that that isn't plagiarism. That's just, it's hard to write that in too many different ways, right? So that's the first match of one, but we can look elsewhere and say at age 70 renewal. And so here's from that journal again. The text from the copyright journal says at age 70 renewal can no longer be done by mail. So you can see this sentence here is identical to the previous sentence that's in the journal. And so this is an example where it feels like the student has not paraphrased the copywritten journal publication enough, and this plagiarism bot is figuring that out. And so, so the key here is to have, when this happens in my courses, I actually like it when it happens, because that allows me to talk with my students about the need to appropriately paraphrase or rewrite the source material you're getting this from, right? So, and so how much is appropriate paraphrasing? That's where the dialogue between you comes out. And that's where you can have this discussion as teams. You can ask your classmates, did I rewrite this sufficiently different that I'm not plagiarizing or the copywritten material? So I just wanted you to see that as an example, because sometimes it's hard to figure out that right line, but that's why we've got teams to figure that out together. I don't know that there's anything more I wanted to go over, and I'm looking to see if there's more I wanted to say. You may have questions, so this would be a good place if anybody has questions to ask us. I'll stop sharing screen. And yeah, Laith, if you have anything, I know you may be in the hospital, but if you have anything you wanted to add by way of sort of truly peer sort of feedback, because you're a peer in a different country, we welcome your input.
Yeah, hello everyone. Thank you, Dr. Amin. So first of all, I just would like to thank you for taking the time to join. I know it's almost 6 a.m. where you are, and I also want to thank Mariam for her excellent presentations as well. So there are just a few points that I wanted to highlight. So at this week, we were expecting 40 articles to be edited. And now we only have 31 articles, which is excellent. But I just wanted to take this chance to remind all of you, if you haven't already, there is still time to work on your articles so that you can catch up with the rest of the tasks for the upcoming weeks. As for the peer review process, I again echo Dr. Amin's opinion on keeping the peer reviews on the talk page, so that since we have this group-based structure, I think it would be more appropriate to keep it on the page's talk page, so that it is accessible to everyone. As for the next steps, I would like to suggest that, just to sum everything up, Dr. Chinmay will assign each group another article to peer review for this week. And ideally, for next week, we'd like, if you think it's appropriate, we'd like for some of you guys to join and share your peer reviews and share your comments and share what you did during the class. I'm not sure if that's doable or if that's accessible, Dr. Chenmay, but ideally, I think that would be excellent for some of the groups just to come and share their work. And for next week, you'll have time to respond to those peer reviews. So for this week, let's just focus on assigning articles to groups and providing feedback. And yeah, that would be all from my side. So, Dr. Amin, there is something that Dr. Chenmay wanted to discuss. I think he just shared the link on the chat. So, one of the groups or one of the students actually worked on a Wikipedia article from the scratch, but they got feedback that it was refused. Dr. Chenmay, please correct me if I'm wrong. So, yeah, so he just wanted your feedback on this issue. Did you share it, Dr. Chenmay?
Yep, I see
Yeah,
it. I'm looking at it now. And so if I just want to make sure I understand the situation, this was to create a new page and it looks like that new page was refused to be created. Do I understand that right? Okay, so I think that well, Wikipedian who refused it, sort of here's the screen sharing. So so this draft references do not show that the subject qualifies. It needs multiple published sources that are in-depth, reliable, secondary, and independent. So um, so there's some guidelines here for what will happen. So I haven't had this exact issue come up for me before. And so one could follow these issues here, sort of ask a question at the help desk or get live help from experienced editors. So rather than revert back and forth, I think those are some good suggested guidelines. Here's some additional things where to get help, how to improve a draft. And then the last thing to do would be or another thing to do would be to write Theo Radish Long on their talk page, right? So I'm just going to click on that talk page here to see who this user is. So this person has done 200. They've made their 206th most prolific Wikipedia editor. So they've created 124 articles in the English language Wikipedia. They're reviewing 2 pages a day. So they're obviously a very active Wikipedian. And it looks like they have a lot of interest in these kinds of pictures. I don't know what to say about that, except that's stuff they like. Okay, here's a list of articles they've created. So a very, very prolific Wikipedian. So you could write them on their talk page and explain here, sort of click here to leave me a message. So you could write this Wikipedian. So again, this is a community. So it would be perfectly reasonable for the team of students to write and say, this is what we're doing as a class assignment in a course, and this is the topic we're working on. And so please guide us on, we have received your review that you took down the page. Please guide us on what is necessary for us to advance this work. Like, do we need to work on our sandbox more to get more references before we go live on Wikipedia, or what the sort of concerns are here? And it looks like actually, is this even a dialogue with, no, this is 17 days ago, but here's a similar dialogue with a different Wikipedian with this Wikipedian, right? So 5 comments, 2 people in this discussion as they're figuring out how to make that page stay live and stay up on Wikipedia. Does that answer the question?
Yeah, 100%. Thank you. Thank you very much. Okay, students, do you have any questions to any of the 3 mentors and guide of Wikipedia? I hope you all are enjoying it and take this opportunity, as today is the holiday. Tomorrow is, I think, most of you are not there, and on Sunday also we have a holiday. So try to finish or start your articles if you have not started yet. So we can start reviewing. So by tomorrow or day after tomorrow, I will be assigning you a group-wise review of the article. So as mentioned by Amin, you can write on the article talk page directly that these are some of the review. And after that week, the owner of the article will the necessary changes if required, take it on the comments. I think this is all from my side. I would again like to thank Amin, Gayet, and Mariam for being with us. I think these last 5 weeks, so 4 and 5 weeks, and inspiring all our students. And I know that your students are really excited and doing great job. A few need little push, and so thank you for taking
Yeah.
your time out of your
Yeah, no,
night
I
sleep.
think yeah, thank you all for being here at the edge of your holiday, I think. But I will just close with like I do with my own students. You have made 10,100 words of improvement to Wikipedia, and those pages you've edited have been viewed 149,000 times. 149,000. I know there's a different, what do you say, lakh in India? In India, I'm not sure what the word for 1,000 is in British Indian English. But the point is, that's the biggest thing you've done in your medical career so far. So you should rightly be proud of making the world a healthier place. And I appreciate you for that. Okay, I think that's all. Yeah.
That's all. Thank you very much, everyone, and big round of applause for all the students. Thank you very much. Those who are not able to join, please guide them. And see you soon on Monday. Have a good day, good weekend. Bye bye. Actually, I'm at the airport, so that's why I need to mute again and again. The rest of
Okay.
my account. Bye. Let me show you something. For Nagpur, for off. So thank you very much, everyone. Bye bye. Samik, we can close the session. Thank you very much, everyone.
Okay.